Okay, I'll give you more for it. Also, Tammy at the Treffert Center.
Hey Barb, can you mute it on your end? Thank you.
Okay. And that way she could.
Yeah.
I don't. If they can hear me on that, fine.
That's on your property.
So, can they hear us?
Hey Barb, can you mute your end there and we'll con?
Is she kidding me?
Yeah.
I've seen that too.
So I'm going to start this. That's fine. How much did that say? How much did you I'll email her. We can do a little later.
We okay anytime? I know you'd prefer.
I sent her an email.
Colleen's got her on text.
You're like, we've had
What? Am I really? Use your turn. So you had that.
Good morning, all. Thank you for coming. My name is Mike DeGeer. I'm pleased to be with you today. Holly asked me to cover for her today. She sends her regrets, and good morning to you. I serve as Vice President for Population Health Management here at Agnesian Healthcare, and I'm very pleased to be with you today. We'll start with a little housekeeping, and then we'll move on to our reflection and introduction of speakers. Before you, you will see a green slip. This is your opportunity to not only get credit for being here, but also to be involved in a drawing for a prize. Is that it?
Yes.
The cup?
It's a cup and it's got some fun little Agnesian.
All right. There's a cup with mystery surprises inside. So if you fill this out, they'll collect these later and we'll draw at the end. There's also a yellow comment card. We take your comments very seriously. It helps us to guide programming moving forward, and your suggestions are always welcome. So please take a moment with that. The lineup for future No One Goes is also on this card. So please take a look at that and mark your calendar. We appreciate your participation, and it really makes for a rewarding session. So thanks for making note of that. The other is a handout that will accompany the speakers today. Holly prepared me with a reflection, which eliminates my ability to freestyle, so you're welcome for that. I will choose the reflection. She actually gave me two options. The first one is the one I'll choose, and it's written by Norman Vincent Peale, and it's entitled Think Positively. If you want to get somewhere, you have to know where you want to go and how to get there. Then never, never, never give up. The secret to life isn't what happens to you, but what you do with what happens to you. Help other people to cope with their problems, and you will find that your own will be easier to cope with. Never use the word impossible seriously again. Toss it into the verbal wastebasket. Self-trust is the first secret of success, so believe in and trust yourself. Stand up to your obstacles and do something about them. you will find that they haven't half the strength that you think they have. Joy increases as you give it and diminishes as you try to keep it for yourself. So in giving it, you will accumulate a deposit of joy greater than you ever believed possible. How you think about a problem is more important than the problem itself. So always think positively. And go at life with abandon. Give it all you've got, and life will give all it has to you. Some great thoughts to frame our conversation today, and we'll get right into it. We're very pleased to have three excellent speakers with us today. I'll introduce the first, and Ed will proceed with introductions of our other speakers as we move forward. We have a behavioral health lineup today, and I'm pleased to introduce our first speaker, Ed Kartheiser. Ed is a licensed professional counselor with a wide range of experience in the behavioral health field. Prior to joining Agnesian Healthcare, Ed was the administrator of several different inpatient and outpatient behavioral health programs. Ed currently serves as the Director of Behavioral Health Services for Agnesian Healthcare. So please join me in welcoming Ed Kartheiser.
Thanks, Doctor, and thank all of you for coming today. It's good to see such a good crowd here. I think you're going to like the lineup that we have for you today. We've got some excellent speakers. As many of you are aware, May is Mental Health Month. And I just wanted to take that opportunity to talk a little bit about what it means to have good mental health, and then give you a brief overview of all of the behavioral health services that we provide, our mental health and addiction services. And then we'll move on to our next speaker, who's Leann Vice-Reshel, one of our child and adolescent therapists. She's going to talk about autism spectrum disorder and attention deficit hyperactivity disorder, so I think that'll be very interesting. And then our third speaker is somebody who really doesn't need very much of an introduction. He's world-renowned as someone who has studied savant syndrome for over 50 years, Dr. Darrell Trafford. So we're very pleased to have him here today. And I recently had the pleasure to see Dr. Trafford accept the Badger of the Year award, and I think that he was more pleased by receiving that award than any other honor I've seen him receive in his career. So it was a wonderful thing, and congratulations on that, Doctor. So, you know, I just wanted to talk a little about, as I think about behavioral health services and the size and the scope of the services that we provide, and the wonderful staff that we have. It's really, you know, something that makes me feel very proud and very blessed. And I think it's a reflection of the mission and values of this organization. You know, it didn't just happen by accident. We have tremendous support for behavioral health services from our administration, from our healthcare providers, from our hospital staff, from leaders like Dr. Trafford, from the general community at large. And it's really an honor to have that. And I think you're going to be impressed by the size and scope of the services that we provide. And like I say, I mean, we've got some wonderful people on our staff. They just are very dedicated to helping people with mental health problems and helping them to achieve and maintain good mental health. As we talk about good mental health, I think it's important to understand that mental health isn't simply the absence of a diagnosable mental illness. It's not just that somebody doesn't have depression, they don't have anxiety or some other psychological issue. It's really having certain abilities, you know, the ability to learn, the ability to feel, express, and manage a range of positive and negative emotions, the ability to form and maintain healthy relationships with others, the ability to cope with and manage adversity, and the ability to make a contribution to your community. So if you look at this list for yourself, just ask yourself, what's more important than having my mental health and having these abilities in my life? there's really not too many things higher on the list than that. Physical health might be another, but mental health is just central to our health and well-being. Unfortunately, for the millions of Americans each year who face the reality of living with mental illness, they're not able to maintain those abilities. Mental illness is a disease of the brain. It causes disturbances in thought, mood, or behavior, and it results in an inability to cope with life's ordinary demands and routines. Unfortunately, mental health concerns are very common in the United States. We know that 1 in 5 adults will experience some form of mental illness in their lifetime. 1 in 10 will suffer from a depressive illness, and 1 in 17 has a serious mental illness such as schizophrenia or bipolar disorder. There are over 200 classified forms of mental illness that have been identified. Some of the more common mental health disorders include depression, anxiety and panic disorder, post-traumatic stress disorder, obsessive compulsive disorder, attention deficit hyperactivity disorder, eating disorders like anorexia and bulimia, bipolar disorder, schizophrenia, and then there's those with dual diagnosis where they experience some form of addiction in addition to a mental illness. But many people who have a mental illness don't really want to talk about it. That's why it's important to emphasize that mental illness is nothing to be ashamed of. It's a medical condition, just like heart disease, diabetes, or any other medical condition. And people shouldn't have to feel ashamed about having that. Studies show that most people with mental health problems do get better with appropriate treatment. We're continually expanding our knowledge of how the brain works and developing new treatments to help people. Fortunately, today we know that, for example, in the case of depression, over 90% of depression is considered to be treatable with the tools and techniques that we have today. So now I want to talk a little bit about some of our different services. We have our Inpatient Behavioral Health Unit that's located here on the 5th floor in the hospital. It serves individuals 18 and older who are experiencing acute mental, emotional, behavioral, and/or substance abuse issues that require intense treatment. The unit has 17 beds and is served by 2 inpatient psychiatrists. Additional staff include psychologists, social workers, substance abuse counselors, nurses, art therapists, dietitians, pharmacists, and spiritual care providers. Patients are generally admitted for various reasons, such as crisis observation. It might be somebody who has just made a suicide attempt, or somebody who's having active suicidal thoughts of hurting themselves and needs to be kept safe. Might be a person who's experiencing a psychotic episode, or somebody who's experiencing an episode of mania as they have bipolar disorder. And then we manage their psychotropic medications intensively on the inpatient unit. So being in that medical setting where they're closely monitored, we can often be more aggressive with a patient's medications and get them better more quickly. And then lastly, we perform alcohol detoxification. And a lot of people don't recognize that detoxing from alcohol can be a very serious medical condition, can be life-threatening. A lot of people think that withdrawing from opioids might need to be done on the inpatient unit, but it's actually not as life-threatening. It's very difficult, of course, but it's something that can be done in the outpatient setting. Moving on to our next level of care, that's called partial hospitalization. It's kind of an intermediate level of care between the inpatient unit and general outpatient therapy where you might get a counseling session once a week. So it's a little more intensive and structured, and then provides a treatment program that's kind of similar to that inpatient setting, but it allows patients to go home at night. PHP offers individuals who have been hospitalized in the inpatient unit the opportunity to kind of gradually step down to a lower level of care and still have a lot of support, but then be moving into the outpatient setting. And then for those who are already in the outpatient setting, it gives them the option to be treated in an outpatient setting rather than having to be in an inpatient setting. PHP is offered 7 days a week and incorporates educational classes and group therapies that provide a wide array of treatment opportunities, and all that's aimed at assisting patients in achieving their treatment goals. In addition to group sessions, PHP provides outpatients with daily access to the same physician, nursing staff, and treatment staff that are available to inpatients. Now we look at the outpatient behavioral health setting, and Agnesian operates 3 certified mental health clinics. These are located, the main one is located here in Fond du Lac, and that's on the 5th floor as well. We have our outpatient clinic there, and that's staffed by about 20 therapists and 6 psychiatrists. So we provide outpatient services for adults, adolescents, children, and their families. The clinic has 2 satellite facilities, one at Ripon Medical Center and another at Waupun Memorial Hospital. We only provide outpatient psychotherapy there. We don't provide the medication component there. But the therapists who work there work again with adults, children, and adolescents and their families. Our next certified mental health clinic is Dallas and Associates, located right here in Fond du Lac, and they have approximately 8 therapists, doctoral level and master's level therapists, who again work with adults, children, and their families. And then there's the Treffert Center, which is a satellite of Dow and Associates, and I'm going to talk about the services there in a little bit. Our third certified mental health center is Psychiatric Associates, which is located down in Beaver Dam. And that has approximately 11 doctoral and master's level therapists, in addition to 2 psychiatrists, Dr. Kirkwood, who works with adult patients, and Dr. Coos, who works with children and adolescents. So they prescribe medications there. And unfortunately, Dr. Coos is going to be retiring at the end of June. He's going to the Hamptons. I hate him. And, so he's looking forward to that, but we're not, as now my task is to find a replacement provider for him, and that's going to be difficult. I want to let you know that administration recently made the decision. We're going to be moving Psychiatric Associates from that Beaver Dam location to the hospital in Waupun. We're going to renovate the 4th floor there, so we think we're going to have a nicer facility for our staff and the patients, and we're going to be able to support the hospital better with behavioral services. So that's targeted to occur sometime in January or February of 2018. Looking at outpatient behavioral health and the services that we provide, we kind of break it into 2 areas. Our psychotherapy services, where we provide assessment and evaluation. We can administer certain psychological assessments to test for the presence or absence of certain psychological disorders. And then we also do neuropsychological assessments that conduct assessments looking at cognitive deficits, learning difficulties, mood disorders, nervous system disorders, and the like. And then, of course, we do individual therapy, group therapy at most of the clinics, but not at those satellite clinics that I talked about. And then child and family therapy, and we also do couples counseling. And then our other service in the outpatient setting is our psychiatric services that I mentioned, where we have medication and evaluation and management by a provider. And then I said I'd talk about the Trafford Academy a little bit. The Trafford, well, we have the Treffert Center, and then within the center is the Trafford Academy, and that works with children aged 2.5 to 12 years of age. And I emphasize all children because some people are under the misconception that the Academy only serves children affected by autism spectrum disorder, and that's not true. It takes all children. It offers 4K morning and afternoon classes, provides full day and half day preschool programs, and conducts a variety of summer programs as well. Then we have the Trafford Clinic, where we have a nurse practitioner, Tammy Langhoff, and she manages the medical care for children affected by autism and also provides behavioral health consultation for children up to age 18. Then Dr. Treffert has his library there with his research and literature collection on autism and savant syndrome, and the library also oversees some autism research. Additional services include occupational therapy, speech and language therapy, psychotherapy, and center-based, what we call ABA services. That's Agnesian Beyond the Boundaries of Autism. And so that program provides in-home and center-based care for children affected by autism and their families. Many people don't realize it, but it serves 20 counties across the state, all the way from Sheboygan to La Crosse. So again, when I talk about the size and scope of behavioral health services, it's really quite vast. And services there include multidisciplinary autism evaluations. Those are very comprehensive evaluations that are conducted at Darrell and Associates. They also provide occupational therapy, speech and language therapy, psychological services, and then additional referral within Agnesian for things like sleep problems, dietary concerns, and the like. Our domestic violence services provide care to any individual who's been a victim or perpetrator of domestic abuse, or any individual who's been affected by abuse against a loved one. Individuals are included who are age 5 and older, whether male or female, and all services are free except our offenders program, which is known as Breaking Abusive Patterns Program, or the BAP program. And the cost for that is $25 per session with a one-time $50 assessment fee, so it's something that's fairly manageable. Domestic violence services provides a wide range of clinical and other services, including psychotherapy, case management, medical advocacy, legal advocacy, prevention education, crisis intervention, group work, and that program is staffed by psychotherapists, social workers, a bachelor's level interns, and a doctor level intern, and psychologists. Moving to our inpatient addiction services, these services include alcohol or other drug abuse assessments, known as AODA assessments. These are completed within 24 hours on the inpatient unit and throughout the hospital. They also provide individual AODA treatment sessions for patients, provide group therapy 7 days per week, have patient education classes, they conduct therapeutic activity therapy, medication education, 12-step support group meeting attendance, family education, support, and referral, as well as discharge planning. Our alcohol or other drug abuse day treatment services allow individuals on the inpatient unit to gradually step down to a lower level of care, similar to the partial hospitalization program that I talked about for our mental health patients. This provides an alternative to inpatient treatment for those patients who are on the outpatient side and would prefer to remain in the outpatient setting versus the inpatient setting. Patients need to be referred by a physician, counselor, or other provider, and services are offered 7 days a week, including individual AODA sessions, individual family or AODA counseling, group therapy, and discharge planning. Oftentimes, patients in this level of care receive what's known as medication-assisted therapy, in which they're prescribed medications such as Suboxone or Vivitrol, and those medications help them to deal with the cravings and urges that they might experience and help them to manage that better. So that's a very helpful tool. In terms of outpatient addiction services, we have our alcohol or drug abuse services that are inclusive of initial AODA assessment, individual family AODA counseling, and then we have our AODA groups. So we have the intensive outpatient program. Patients in that program meet frequently in a group setting where they learn about the progression of addiction, common withdrawal symptoms, how to manage urges and cravings and things like that. Then we have our relapse prevention group. That helps individuals in recovery to gain the knowledge, skills, and techniques that they need to remain free from addiction. We have our Seeking Safety group, which is an evidence-based program for men and women experiencing issues related to trauma and or addiction. And then we have our Family Addiction Education program that's designed to educate family members and friends who have someone who's either actively in addiction or in the early recovery process. So I just wanted to put our website on here. That's where you can really get all of this information pretty easily. I put the phone numbers of the different programs that are available. And once again, I think, when you look at all of the programs that I talked about, it's really impressive the size and the scope of the services that we provide for an organization the size of Agnesian. And again, I think that really reflects the support of our hospital administration, our healthcare providers, and you as our staff. So now I will move on to our next speaker. And as a child and adolescent psychotherapist, she has a great deal of specialized training and working with children and adolescents. She absolutely loves doing it, and her enthusiasm comes through. She treats a variety of normal adjustment issues, such as dealing with anxiety in relation to starting out in a new school, or a child who has a new sibling in the home, who's experienced the loss of a loved one, who has fears, nightmares, peer difficulties, social skill issues, and the like. She earned her bachelor's degree in sociology from Augsburg College and her master's degree in clinical psychology from Alliant International University. She enjoys being outdoors and incorporating the natural outdoor environment into everyday living. Please join me in welcoming Leann Vice-Reshel.
Thank you for the introduction, Ed, and thank you everyone for being here today. I really appreciate it, and I appreciate the opportunity to come and speak with you all about autism spectrum, ADHD, and beyond. And I'll explain what the beyond is in a second. So today I'm going to probably skim through a couple of the slides just for time, and then if you have questions on any of the slides at the end, just let me know and we can flip back through them, okay? So one of the things that you'll see throughout today, and one of the things I really want you to take into consideration and remember, is that in talking about kids with autism and ADHD and any neurodevelopmental disorder, or really any mental health diagnosis, when you've met one kid with autism, you've met one kid with autism. Many of you have probably heard this quote, but remove autism and apply any other mental health diagnosis. This means every person's unique. So because we have a cluster of symptoms doesn't necessarily mean that every person who's been diagnosed with a diagnosis fits exactly what we would see those symptoms to be. So autism and ADHD are neurodevelopmental disorders. Neurodevelopmental disorders are a group of conditions with onset in early developmental period. Oftentimes this happens before the grade school age. Oftentimes we'll see characterized by developmental deficits in personal, social, academic, and occupational functioning. One of the things that I'm going to talk about in a second here is that neurodevelopmental disorders, you have learning disabilities, autism, ADHD, intellectual disorders, they oftentimes co-occur, meaning they happen together. And this is oftentimes overlooked. We think, well, if you have one individual who's been diagnosed with autism, that's all they have as a diagnosis. But we're seeing more and more that they co-occur, they happen together. And that's because of symptom overlap. I'll explain in a second. So a little bit about the background. Autism spectrum disorder, which is now what we're calling autism, is a developmental disability that causes significant social, emotional, and behavioral challenges. Okay, the social and the communication being key. Some of the first signs often that we see happen in toddler years or before. This is oftentimes seen with lack of eye contact, unusual play with toys, so example, lining up cars or lining up toys, rigidity in playing with toys. I only want to play with this toy and no other toys. Repeating quotes from movies, TV shows, appearing like they have really good memory for that. Repetitive motions. What is ADHD? ADHD, attention deficit hyperactivity disorder. Used to be classified ADD, so now it's ADHD. I'll explain more in a second. It's a brain disorder that's marked by ongoing pattern of inattention, hyperactivity, impulsivity that impacts functioning and development. There's 3 types of ADHD. We have inattentive, which is I have difficulty concentrating, can't focus, I have difficulty basically hearing and listening to what you're saying. There's the hyperactivity and impulsivity piece. So this is oftentimes the kids that we appear to look like Energizer bunnies. Can't sit still, climbing on everything, climbing inappropriately on everything. Would rather run than walk down the hall. Okay? Some of you may be nodding your heads like, yep, seen that before. And then there's combined. You can have inattentiveness and hyperactivity at the same time. So it's important to know when we're going into talking about this, what ADHD and autism are. Both neurodevelopmental disorders. Okay. Why is it important to know? Because oftentimes ADHD and autism symptoms overlap, meaning that there's similarities in how these symptoms present. So because they overlap, they can oftentimes get misdiagnosed, or a diagnosis may be missed altogether. Some of the symptoms that overlap are trouble paying attention and trouble with social interactions. Some of the causes of neurodevelopmental disorders, a lot of you may have heard the vaccine myth. Okay, a lot of you may have heard autism and ADHD are caused by issues that happen at birth or prior to birth with mother or father. Environmental factors such as what's in our food now and toxins in the air. There's a lot of different research, a lot of different information floating around. Some of the primary research that we're focusing more on is genetics. Autism and ADHD being having a genetic component to what causes this. Dr. Treffert's going to talk to this a little bit more later, so I don't want to go too much into it, but In some cases, certain conditions such as intellectual disabilities are associated with specific gene malformations that occur. So this is the main crux of the point that I want to share today, is diagnosis. It's really important that when you see some of the symptoms that we just talked about, or you see anyone, not just kids, adults, teenagers, who have some of these symptoms, bring them in for a diagnosis. I just laid out very nicely all of the different treatments that we have, all the different options that we have here at Agnesian. But sometimes the overlapping symptoms can cause children to get incorrectly diagnosed. And there's a lot of research now showing that kids who have diagnosed with ADHD at a young age often get misdiagnosed and truly have a diagnosis of autism. And so it's important that we go through and we do our due diligence with diagnosis. Some of the newest versions of the DSM allows a person to be diagnosed with both. So just because a child or an adolescent has been diagnosed with autism doesn't necessarily that they don't also meet the criteria for ADHD. Kids with ADHD oftentimes have learning disabilities as well. So it's important that we're doing our due diligence. The Treffert Center has a really great diagnostic center as well to help with that as well. So this is also important because the symptom severity differs from different places. So structured environments versus unstructured environments. So you may have a kid that does fantastic at soccer practice because the coach is very structured and tells them exactly where to be at the exact time, when to be there, and how to do it. But they go home and there's no structure. There's no schedule. And all those behaviors get more severe. So it's important that we're looking across the lifespan, across the different areas of where these individuals are throughout their day and what they're doing. Treatment. Oftentimes the best treatment is a combination of treatments, not just one treatment. So not just in-home therapy or individual therapy or medication. Oftentimes when people hear ADHD, one of the first things I hear from parents is, are you going to put my kid on medication? We're not going to jump right to medication. Yes, medication can be helpful. There are certain things that can be helpful for it. But there's also a combination. So individual psychotherapy with pharmaceuticals, as well as school-based and in-home programs. Oftentimes kids with ADHD and autism have sensory difficulties, meaning I don't like being hugged. It feels like I'm being pricked with needles. Or it's too loud in here. It's really quiet, but to some kids, this fan I'm hearing may seem like some nails on a chalkboard. So that's where occupational therapy is helpful. Some kids with autism have difficulty with communication. Language development, it's one of the milestones, right? Oftentimes, it's a delayed milestone. So speech therapy, another great form of treatment. Family therapy and parent training is also very important. So helping parents to understand, well, yes, I'm going to help your child to learn social skills, but it's also important that you know how to implement these social skills at home, that you know how to take these social skills and implement them yourself, because I only work with your child for 45 to 50 minutes, sometimes 2 hours if it's in-home therapy, throughout the week. But you're with your kid 24 hours a day, 7 days a week, the front-line therapist. So parent training is key. So one of the things that I've actually learned from Dr. Treffert, and also throughout my work with autism and ADHD and neurodevelopmental disorders, is teaching to the strength rather than teaching to the deficit. Use a child's strengths to help to fill in those gaps. Rather than looking at this as and I talked about this as well, is rather than looking at this as a cluster of symptoms and things that someone is lacking, what's this child and the adolescent and the adult's strength? What are they really good at? Okay, now let's use that strength and let's build that strength. Just like we would going to the gym to build our muscles, let's build up that strength to be able to teach these other areas that are lacking. Okay? So if a kid really likes drawing, I'm going to use drawing to help teach those social skills that the child may be lacking. So I put in some of the strengths here. You can read through the list if you want, but some of these are like some of the main strengths that we would see for autism and ADHD that are oftentimes overlooked. You know, rather than being a kid that just blurts out words randomly, well, that's a really honest kid. Rather than being a kid who's an Energizer bunny and can't sit still, they have a lot of energy. They may be really good at playing a sport. Put them in cross country. Go, run. Great imaginations, really creative. Some of the brightest minds of all time had autism, ADHD. So, find a strength, use it. Ways to assist building health and life success. Okay, remembering that these are the features, abilities, and severities of symptoms happen on a spectrum. It's not just black or white, severe or mild. There's this middle ground. Okay. Assume intelligence. Always assume that someone is intelligent. Teach to the ability, not the disability. Be respectful above all else. We're all human, bottom line. So right now, Dr. Treffert and I would like to share a video clip from Taylor Crow. This video clip helps to show that the importance of diagnosis. That oftentimes individuals who look just like they have mild symptoms or just behavioral issues, they get a delayed diagnosis. And this video clip is going to help from a first-hand perspective to show why it's important to bring individuals in for diagnosis because of the possibility of delayed diagnosis. So if we can roll that clip.
Kids who seem to have a perfectly normal childhood at first.
I think you're wonderful.
Tweety bird.
Tweety bird, that's right. That's right. Beep beep, that's a road runner. Taylor, you're so smart.
I love this video because it gives you a rare opportunity to see into a child who's developing normally, seemingly, before the onset of autism. It allows you to see that Taylor was demonstrating, if not just normal, above normal speech and language skills. If I were to see a 2-year-old who was using, say, 2 to 4 words in a sentence with maybe 50 to 75% intelligibility, I would say he was doing fine. But in this video, you see Taylor, who's using 7 to 9 words in a sentence. He has nearly 100% intelligibility. He has excellent use of the rules of language, the word order, the meaning to the words, the word ending, the pronoun, all of these things he's using appropriately. And he's interacting with his mother appropriately with great eye contact and turn-taking. And it's really amazing to see how typical and above and beyond his language skills were prior to the onset of autism.
Big blue-eyed, little tousled-haired 2-year-old, and he was eager and ready to learn. He was excited. He would come and call me by name, Miss Susan. He would call his classmates by name. He would participate in all the activities that we had, particularly the sensory activities, the painting, the pouring beans, and the playing with Play-Doh. He enjoyed books.
I distinctly remember a visit at around 4 years of age where his parents basically were totally frustrated about a sudden change in his personality. He'd gone from a communicative child to a child who didn't talk and was a very difficult child to deal with. And when we saw it at that point, we did in fact see a child who had gone from a very normal childhood to someone very different.
For 2 years, Taylor and I had a bond of love and time spent together that I wouldn't give for anything else in the world. And we transitioned into a time that Taylor was showing such bizarre behavior. I would pick up the box of cereal to pour him some cereal, and my doing that would set him off into uncontrollable screams. And And I could tell that it was just my action of reaching for the box of cereal. And it took me several weeks to figure out that it was where I had my hand on the cereal box. And perhaps, I don't know, perhaps I was covering up someone's face or the cornflake rooster's body. There had to be something that I was touching that he didn't want me to touch. And that was just one thing I figured out. His whole life was like that all day long, that I was having to be a detective and try to figure out what I was doing that caused him such discomfort that he would scream. And we soon got to the point that I would say he was screaming and crying approximately 30 minutes out of every hour that he was awake. And it was devastating.
By this time, I had changed. My autism had taken hold around age 3. Language was hard for me. I had a Mickey Mouse cake for my birthday that year. Usually seeing Mickey made me happy, but here I panicked because Mickey was going to be cut up. I couldn't help this.
I was 3, 4, 5 years old and spent part of every waking hour, every day screaming when he couldn't be touched or held or comforted because it seemed to hurt and make him scream louder, or when he'd withdraw and not respond to anything around him. And then when he eventually talked, he could only use single words or simple 3 or 4 word sentences. These days, people tell me they're surprised to learn that Taylor is autistic. I recall the months when we couldn't get him outside or even to a room in our house that had windows because he had developed a deathly fear of clouds. And that was just one of the unusual and uncontrollable fears that arrived after his autism had taken hold. Autism. You might not notice my autism very much, and that's part of the story I'm about to tell. But first I want you to know what I'm doing these days. As we're filming this, I'm a senior at the California Institute of the Arts, majoring in character animation. CalArts is the most famous animation school in the world. John Lasseter, the head of Pixar and Disney Animation, the guy that did Toy Story and Cars and Finding Nemo, majored in character animation at CalArts. So did Brad Bird, who created The Incredibles. Steven Hillenburg, who came up with SpongeBob, also majored in character animation at CalArts. And me. Less than 1 in 5 who apply get accepted, and I got in on my first try. Hearing someone describe Taylor as mildly autistic is a remarkable, joyful thing every time I hear it. It's wonderful. It's an answered prayer. And it's the result of Taylor working very, very hard to make it happen. He's an extraordinary person. He is an inspiration to me.
So, I really like this video clip, and thank you for sharing this from your personal reflection, Dr. Treffert. I really like this because it does a fantastic job sharing why it's important to go into looking at diagnosis early. It also does a really good job at showing if you find someone's strength, like Taylor did with his animation, anyone can succeed and can go very far in life, right? So one of the other pieces to why it's important for early diagnosis is because in the state of Wisconsin, and just like in every state, there is certain ages that a person has to be diagnosed prior to in order to receive certain services, such as in-home services. So that's another reason why it's important for early diagnosis. Okay, just something to remind you of. One of the other populations that is oftentimes overlooked is the transitional age youth. So transitional age meaning teenage years up through early to mid-adulthood, mid-20s. The challenges of transitioning into adulthood without a neurodevelopmental disorder, as hard as it is, right? Probably all remember your own transition. Probably some rough patches. Well, that's even harder when some of these symptoms and behaviors of neurodevelopmental disabilities come along with the individual. So these are disorders that oftentimes are permanent. So it's important to know that for transitional age youth, there are specific services that are developed and set in place. So in our community specifically, I put up a few of these resources for you to take a look at. We have the Treffert Center, which is first, as I pointed out, for ages 2.5 to 12. Also, at the Treffert Center, we have a therapist who will work with individuals. Do you know what ages Brian works with? Again?
Brian works primarily with
teenagers. Yep, so he works with teenagers. And then we have ABBA, so Agnesians Beyond Boundary of Autism. There's a comprehensive service integration of Fond du Lac, which put their website up there. This has a listing of all the different mental health resources around Fond du Lac. ADRC of Fond du Lac County and Transitional Improvement Grant website has all the resources for Fond du Lac County and beyond for transitional age youth. So at this time I want to invite Dr. Darrell Trafford to come on up and for a few closing remarks and to share with us his wisdom. He's been a true inspiration to me in my work that I do, and I believe to everyone in this room. So Dr. Trafford.
Good. Thank you very much. I just have a couple of things I want to say. First of all, pay attention to your own mental health today. I had a drive-in from the Holy Land this morning, and the flowering crab trees are in their beauty. The daffodils and the tulips, the green grass and the lake, that's our tranquilizer. That's our antidepressant. And I know you have to work during the day today, but this is the time of year of renewal, the beauty of this planet, God's gift to us of this spectacular place that we have a period of time to live on is something that we ought to enjoy, and that is the best antidepressant of all. Second thing I want to say is that I'm so proud of our services here, behavioral services, and some of the people that you've heard. I know the facilities pretty much around the country, around the state, and I will hold our behavioral health services in Fond du Lac up to any of those around the world. The breadth and depth, and more important that the people that we have here who are dispensing this mental health is a part of the reason why I'm still here. I'm a long-term St. Agnes admirer. I was born here back in 1933. It was never my intent to return to my hometown to practice psychiatry, but I did, and it's been a splendid place to practice psychiatry, and now to have the Treffert Center to carry on my work is something beyond my fondest dreams, actually. So the other thing I wanted to say briefly is that I came into psychiatry in 1962. At that time, there were no tranquilizers, there were no antipsychotics, there were no antidepressants. We had insulin, chemotherapy, lobotomy, and barbiturates. So I've witnessed in this career of mine our transition from a time when we had very little to offer people with mental illness to where we have a great deal to offer now. The tranquilizers were invented or discovered by somebody who was looking for a better antihistamine that didn't make people drowsy. And they were using this drug on mice, and they said, you know, these mice don't get drowsy, but they become tranquil. And so he invented sort of stumbled onto Thorazine, which is an antipsychotic. And Thorazine and the antipsychotics are to medicine what penicillin is to medicine. It revolutionized and allowed us to treat people who can recover. A fellow who was running a TB SAN, most of you aren't old enough to remember when we had TB SANs, when people could be locked away because they had a contagious disease. We had some in this area. And he was treating them with an antibiotic, and he noticed that some of the patients with tuberculosis weren't as depressed as others. And he stumbled on the antidepressants because the antibiotic that he was using had the patient less depressed. So that I witnessed this transition from a time of little or no treatment into a time of discovery and time of treatment and recovery. And we've been very much a part of that here at the hospital. No matter what the mental illness is, whether it's autism or whether it's psychosis or whether it's dementia, the strategy that I use and try to impress on people using is looking for what I call that island of intactness. The first little girl that I saw who was autistic was when I was on a psychiatry service in Madison. It was my first day on child psychiatry. And it happened to be housed in a different building. And I walked up to the building, and just was this terrible thumping. The whole building was just shaking. And I thought, that's odd. And I walked in, and here's this 12-year-old girl with a helmet, banging her head on the desk to where the whole building would shake. And it occurred to me that somewhere in that girl, somewhere in that little gal, in that imprisoned body, was an island of intactness. Somewhere is an island of health in that little girl, rather than just this disability. And our job was to find that island of intactness, and that's what we do at the Treffert Center. And that's what we do upstairs on the 5th floor, looking for that island of intactness and then to find it and discover it and build on it. And it's amazing what happens when you do that. So no matter what kind of patient you're dealing with, it is that search for intactness that is the ultimate discovery and treatment. So anyway, just want to underscore how lucky we are to have this unit here and how privileged I've been to be a part of it, and how grateful I am to St. Agnes Hospital for allowing the work to continue at the Treffert Center. Yesterday I was, and I'm very appreciative of this place and the warmth. I was giving a talk the other day in another city, and rather than giving my usual curriculum vitae as an introduction, they introduced me as a psychiatrist, and they wanted to define the psychiatrist as the care of the id by the odd. Now, I hope that is not your impression of psychiatrists at all, because we have some of the best people working here that we could imagine. So it's been a privilege to be a part of this. I intend to stay unretired for as long as I can, and to work with people like you at St. Agnes Hospital. And I appreciate the opportunity to say good morning to you. And look at those crab trees on the way home, and the daffodils, and the tulips. That's God's gift to us, and reminding us what a blessed planet this really is. Thank you.
Just outstanding presentation. Thank you all for taking the time this morning and sharing your wealth of knowledge with us. We do have a few moments for a couple of questions if you have them. Katie's collecting the green slips for the drawing that we'll do in just a couple of minutes, but are there any questions from the group for any of our panelists? Please.
I was just wondering, what was the island of intactness for that little girl?
In her case, we were able to find a an art ability that was submerged, that finally by drawing. I don't know how many of you remember or have seen Stephen Wiltshire, but Stephen Wiltshire is this fellow in London who flies over a city for 45 minutes and then spends the next 7 days drawing that city window by window and brick by brick and door by door. It's simply amazing that he can do that. And what happened with Stephen is that he was mute. He was severely autistic. I've got some video of him when he was as in prison as he was. And one day, and he never spoke any words, one day he said, paper. And one of the teachers' light bulb went on and she got some paper and some crayons and gave it to Stephen and he began to draw. And he is the world's best artist now. So it's that, and it happened with this little girl. And at Winnebago, sometimes it was music and sometimes it was art, but it was the therapist who was attentive enough and empathic enough to recognize. And but anyway, the answer to in her case, it was that buried ability. Any other questions?
Dr. Treffert.
Mm-hmm.
I know I'm asking a question.
Yeah.
Can you just really briefly tell the audience a little bit about the hyperlexia work that you've been doing?
Yeah, actually, what I noticed was that I get 2 or 3 or 4 emails a day from around the world saying, I've got a son or daughter who, and they write to me and they read about the savant work and their child may be bright in some area or other, and they say, is this child a savant or not? And I always write back, although I'm getting to where it's going to be difficult to keep up, but I do write back on each of those. And what I noticed is that when the special skill of the child was the ability to read early, that they had a different outcome than many autistic children. They turned out to be entirely neurotypical children. And for a period of time, they had autistic-like symptoms, but it's not autism. And so I began to separate hyperlexia into 3 different categories. And hyperlexia 3 is a category in which the child reads early, has some autistic-like symptoms for a period of time, but outgrows those symptoms and turns out to be entirely neurotypical. And I've sort of developed a reputation in the world now as a hyperlexia 3 guru, I guess. And with so many grateful parents who say, now that I've been doing this and have enough time to follow these kids, they write back and say, Dr. Treffert, you're right. You were right. My child turned out, and they were scared, they were hopeless, and now they find out that their child is okay. And that, we just published a hyperlexia manual, which if anybody is interested in terms of looking at children who read early. The same thing is true of children who speak late. Many of those children end up also entirely neurotypical, but in the meantime, the parents have a frantic worry and search as to whether my child might be autistic or not. And the real payoff to my work presently is the letters from these parents who say, you were right, Dr. Treffert, and are so grateful as to, and the success stories that I can read are worth going across the street, coming down the hill from the Holy Land every day and spending a little time at the Treffert Center. So the hyperlexia, I think we're really making a mark. Hyperlexia 3 is not a recognized disease yet in the DSM-5, but it will be. And it ought to be to save the parents some of this turmoil. So I appreciate the question, and I'm spending an awful lot of time right now in hyperlexia 3, and that is really accelerating. Yes?
What is the highest age to onset of autism?
Yeah, the question is age of onset of autism. There's sort of 2 forms of autism. Early onset, which is from birth, And then there's late onset autism. Taylor Crow is late onset autism, about 3, 4, or 5. And that's when you sometimes see the late onset. It's 3, 4, or 5. You usually don't see it much after that. So usually there are congenital forms from early on and late onset. We had Taylor Crow here a couple years ago to give his presentation, and it was really impressive. His dad said for a lad who had lost his speech and had lost all of his affection and had lost all of his contact with mom and dad, to have him up in front of this audience in Wisconsin Dells talking about his autism was so inspirational to him and to the audience. Unfortunately, his father died shortly after that, but he has put together what's called the Taylor Institute, which is in Missouri, a place where children with special abilities, like savant abilities, can go to really drag those to their pinnacle. And that's part of what we're doing across the street. Somehow our staff has managed to find some savants out there, which has really been I didn't know there were that many around, but artists, electronics, computers, and Brian, one of our therapists, has a group of kids that presented their story at the autism conference in Wisconsin Dells last week. They were on the program talking about what their success was, and that was a proud moment as well for me to see them not listening to the audience, but listening as part of the audience, but giving a presentation. And there's more to follow. We're going to get, what happens now with kids who have autism is that we have good special services in the school system and in our community, but at about age 18, you fall off the cliff. There's nothing there. Video games in the basement, being isolated. So our next step at the Treffert Center will be to start an after 18 age group, and maybe even, who knows, maybe even a residential facility. I probably won't be here to see that, but I got it in my head that maybe we should be doing that. So it's a long-winded answer to your question, but any other questions at all?
Very good. Thank you so much again. Dr. Treffert, would you mind doing the honors?
Sure.
Picking our winner today?
Becky McDowell.